Hello, Mrs. Day. Thanks for coming in today after dialysis.
Hello, Dr. Williams.
How is dialysis going? How are you doing?
Well, I'm doing pretty good.
Good. Any concerns that I need to be aware of?
Well, yes. I was talking to my neighbor who told me that she's had a colonoscopy, and I was wondering if it was time for me to have one. I know it's been about 10 years now.
All right. Well, that's a very good question, and it's a tricky question for somebody who's on dialysis. Tell me first, do you have any change in your bowel movements?
Yes, I do.
Okay.
Yes. I've been constipated.
All right.
Yeah.
Is that something new for you, or has that been going on for a while?
Well, pretty much since I've been on the dialysis. I guess in the past 6 months it's gotten a little worse than it was initially.
So you've been on dialysis for about a year.
Yes.
Any blood in your stool at all?
No blood in my stool.
Okay. Any abdominal pain?
No, I haven't had any of that.
All right. How about, has anyone in your family ever had colon cancer?
No, not that I'm aware of.
Okay, good. I'm glad about that. Constipation is very typical for individuals on dialysis because once you start dialysis, your fluid intake is so limited, and drinking more fluid is one of the number one treatments for constipation. But if you haven't had any other changes in your bowel movement, and it sounds like this has been more of a chronic problem than something that has happened acutely with the constipation,
Mm-hmm.
I don't think that you need to have routine colon cancer screening. The reason is that with some of the routine colon screening, such as checking for blood in the stool, dialysis patients usually have some blood in the stool because of their kidney failure and changes in the way their platelets that help clot the blood, how their platelets work.
I see.
But the other is that the screening test itself and the preparation for it can be very, very difficult for individuals on dialysis and actually cause complications. You have to drink a lot of fluid to clean out your colon, and when that happens, you can develop electrolyte abnormalities, so your phosphorus can go way up, your calcium can go very low, and your potassium can change too.
Mm-hmm.
Plus, it can lower your blood pressure. And with all the other medications you're on for your heart, that can put you at risk of having too low a blood pressure.
I see. Okay.
Luckily, we get to see you 3 times a week. So you have an opportunity to tell us if you have any changes in your bowel movements or in any other symptoms. If all of a sudden you have changes or new symptoms that are suggestive of colon cancer, then we would do a colon screening test or look for cancer. But it seems to me that your risks for cancer, you don't have any symptoms of colon cancer, and your risks are very low.
Okay.
How did your friend do who had the colonoscopy?
I think she's doing all right. The neighbor, she said she's doing okay. So
Wonderful. That's very good. Do you have any other questions about cancer screening?
yes, I used to get a mammogram. It's every year, and I was wondering if it was time for me to get a mammogram, or do I need one?
Another good question. I'm glad you used to get your mammograms every year. Very important for women without kidney failure to get mammograms. Unfortunately, once somebody has kidney failure, the calcium and phosphorus balance really changes. You know that. We talk a lot about your phosphorus and the phosphorus in your diet and your phosphorus levels and your parathyroid levels. Because of that change in calcium and phosphorus balance that occurs with kidney failure, calcifications occur in the breast, which lead to false positives on mammograms, meaning that a routine mammogram can have an appearance of cancer, but there's no cancer there. Mm-hmm. That leads to unnecessary biopsies, more tests, and often a lot of stress involved. Mm-hmm. The other reason we don't do routine breast mammograms for women on dialysis is that the breast cancer itself, the diagnosis of breast cancer is not going to change the survival of somebody on dialysis who is not going to be getting a kidney transplant. So for you, who unfortunately does not qualify for a kidney transplant, even diagnosing breast cancer and treating it and putting you through all the treatment for breast cancer, that would not change your survival on dialysis. So when we do cancer screening, we look at an individual's risk for the cancer, and we look at the impact that that cancer would have on the individual's survival, which is very different than the impact it would have on somebody who does not have kidney failure compared to someone with kidney failure.
I see.
If you would have a change in your breast, or we would find a lymph node on examination under your arm, we would then talk about should you pursue having a test for breast cancer or not. Based on if we found breast cancer, would we proceed with any treatment or therapy? Does that make sense to you?
Ah, yes, it does. And if it's not going to help me, then it's, I would not want to have all those tests. So
I think that what you said is absolutely right on, and that we would only want to do tests or investigations or certainly procedures if they were going to help you and make a difference in your outcome and quality of life.
Okay.
And you know that if you have any other questions or concerns about cancer or your risk for cancer, let us know.
All right, I sure
Okay?
will. Yes.
All right.